June is Alzheimer's and Brain Awareness Month. So what causes the disease and what can you do to prevent it from happening to you? Joining us this morning with what you need to know is Dr. Huidy Shu, Chief of Neurology at Hawaii Pacific Health. Good morning, Dr. Shu. How are you doing this morning?
I'm fine. Thanks for having us do this talk.
Now, first off, what's the difference between Alzheimer's and dementia?
You know, dementia is a general term for the brain condition when there's progressive loss of memory, language, reasoning. If it's severe enough to affect someone's daily life, then we call it dementia. And this usually happens in our older population. Alzheimer's is the most common specific disease that causes dementia. There may be 50 different diseases that cause dementia, but Alzheimer's is the most common by far.
Now, a lot of people are wondering what causes Alzheimer's.
Yeah, Alzheimer's has been studied for many decades, and it's still a little bit of a mystery. What we know about it is that when it begins, there's synaptic dysfunction, meaning the connections between the brain cells, they don't work well. Over time, this progresses to loss of brain cells, actually, brain cells dying faster than they normally would without Alzheimer's. And we think this is mostly driven by the buildup of this protein in the brain called beta amyloid. There's a lot of research over many decades to support that idea that beta amyloid is what drives this whole disease.
Now, Dr. Shu, are there any warning signs that you can be aware of?
Yeah, that's a great question, Ross. The most common warning sign of dementia or Alzheimer's is short-term memory loss. Not remembering things like from a long time ago, but kind of remembering things that kind of just happened today or yesterday or just recently. But it's not the only symptom that we want people to look out for. People sometimes have problems with planning and problem solving. They have problems paying their bills on time, or remembering how to cook things that they have cooked for many, many years. Sometimes people have problems with judgment. They make bad financial decisions. They lose money to scammers. Sometimes people have problems with behavior and mood. They might develop depression late in life, or grumpiness, irritability. So these are all different symptoms.
And doctor, what are some of the risk factors?
There are some risk factors that you can't control, things like just being older. Age is the #1 risk factor for developing Alzheimer's disease. Family history and kind of the genetics, your genetic makeup, that is another risk factor. But again, these things you can't control necessarily. The things that you can control are things like a sedentary lifestyle, like sitting around too much. That's a risk factor. So get moving, get exercising, get moving around. High blood pressure is a risk factor. Diabetes is a risk factor. Excessive alcohol consumption, head injuries, smoking, all these things that, your primary care doctor tries to get you to make better in your life. Those are the things that drive Alzheimer's disease.
Okay, so now that we know some of the risk factors, what they are, what kind of lifestyle changes can help prevent Alzheimer's?
Yeah, that's a really wonderful question, Ross. We always recommend a number of things to all of our patients who come to see us about memory disorders. The #1 thing is usually exercise as much as you can. Exercise your body every single day. The amount depends on what your body can take, really, right? As people get older, they can't necessarily all do the same types of sports or activities that they did when they're younger. But just moving even a little bit in terms of walking around is very important. Brain training, so staying active with your brain, forming social connections, being around other people, all of those things really exercise your brain in addition to your body. That has been shown to be protective. Eating healthy diets, Mediterranean diet is a specially recommended diet. Stopping smoking, minimizing alcohol consumption, and avoiding falls and head trauma. These are all things that we recommend for people to try to prevent them from developing dementia over time.
All right, thank you very much, Dr. Shu. There's some great tips. Thanks for joining us this morning, and have a great day.
Yeah, my pleasure. Thank you.